This is the fifth in my series of 7 short videos about zero harm. In the previous two I described the 2 systems which are essential for zero harm. In this one I'll describe zero harm behaviours. My list of zero harm behaviours includes, but not limited to, always, whatever the circumstances, treating patients and their loved ones with compassion, dignity, respect, and all of the behaviours which are so essential to healthcare. The ability to assess your own performance and act on what you find. The ability to ask a colleague to assess your performance, to accept the feedback and act on it without getting upset. The ability to influence your fellow team members to assess themselves and accept and act on each other's feedback. The assertiveness to set out for senior staff any patient safety issues which arise. For those staff who lead, supervise and manage others, the strength to ask them, what do you need me to do to help you to deliver zero harm? And also, what do you need me to stop doing to help you to deliver zero harm? The personal strength to be able to own up to making errors, to report them and to accept the consequences. The personal strength and professional commitment to be able to tell a patient or loved one that you made errors and have caused harm. The personal strength to understand when you are the person who must resign or be demoted because you're the one whose failure caused harm or let others down. For those staff who lead, supervise and manage others, the strength to allow your staff to speak out and report near misses, errors and harm without fear of blame, and to give them all the support they need while these events are properly investigated, and then fairly to impose proportionate sanctions when sanctions are appropriate. The strength to be honest at all times with colleagues, patients and their relatives. The strength to be fair at all times with colleagues, patients and their relatives. And of course, all of the skills and disciplines which are currently described as human factors, broadly speaking, interpersonal skills, team skills, communication skills, and how equipment and the working environment can have an impact on our performance. When everyone in an organisation behaves like this as a matter of routine, it will very probably be able to describe itself as honest, open, candid, professional, just, patient-centred, supportive and safety conscious. In fact, all of the things Robert Francis in his report of the Mid-Staff's public inquiry called for, and whistleblowers won't be needed in this organisation. These are the characteristics of an organisation that should be able to deliver zero harm healthcare. So how do staff develop these behaviours? Everyone in healthcare should really start to develop these behaviours during their education and training. But for here and now, the start can be made right away. Perhaps you can, hand on heart, say that's the way you behave anyway. Well done for that. Perhaps some of your colleagues, however, need some help. I hope you'll be able to help them and coach them. Across the whole NHS, this will need a whole range of development efforts, which will probably extend over many months. I believe all of this will need to be led by the front line themselves. Many of the skills I list are absolutely common these days, of course, and can easily be acquired. Others will be more challenging, because we know that the NHS has really been falling short on them for many years. And I suggest that people start off by working through these behaviours with a colleague who can be relied on as a buddy, someone who is equally willing to work at developing them. There will be many awkward and uncomfortable issues arising though, which every team and larger working unit will need to tackle together, ideally with a facilitator. Delivering zero harm healthcare, meeting the challenges set by a safety management system and working through past failures will often call for facing up to some very awkward issues and working out how to manage them. When difficult subjects are to be tackled for the first time, I call them honesty in action sessions. Getting to zero harm will call on every staff member, in essence, to renew their professional commitment to their patients and to keep renewing it. For many long established habits and behaviours will need to be abandoned and entirely new ones adopted. The zero harm behaviours definitely exclude all of those nasty, bullying, inhuman, uncaring behaviours which define the disaster at Mid-Staffs Hospital. And unless every staff member displays these behaviours constantly and consistently, the environment for delivering zero harm healthcare will not be present. So candour, openness, honesty and fairness each and every day are fundamental. The development of this set of behaviours will be for every single staff member in the NHS, those who deliver the care and treatment and those in every single support and administrative role. Zero harm will be delayed or become undeliverable if the whole sector doesn't adopt this new way. In the next video, I'll talk a little bit about leadership in zero harm healthcare.